Right, we turn now to item 7 on the agenda, which is improving the quality of customer insight through NHS Citizen. I think you, Jane, will be introducing the paper, and I know others will be contributing, but may I turn to you, please?
Thank you very much, Malcolm. So this paper summarises the changes that we're proposing to NHS Citizen. And the approach has been developed over the past few months, mainly following a report that was published in May, which was a learning review about how NHS Citizen had both been delivered and some of the positives and some of the things that could be done better. And that review was actually put together by the 4 organisations that we commissioned to deliver NHS Citizen, and had quite wide engagement from lots of different key stakeholders, but also people involved in Citizen from the very beginning. And we know that we had around 4,000 citizens that were involved in the original programme, so quite widespread. What it showed was that the Citizen had developed into a really valued brand, so lots of people welcomed it, they liked the name, they liked what it stood for. And we have got something like 800 patient representatives across our different groups in NHS England at the moment, which has been really positive. But the review recommended that although we should retain the NHS Citizen brand, we should think slightly differently about how we implemented it in the future. So we could concentrate on having a much more broad and comprehensive picture of citizen views, so that we looked at even some of the things that were often quite uncomfortable for us to hear, because that's a really important part of engaging with our patients and the public, but that we also looked at a wider range of sources, so things like surveys as well as insight, use of social media, etc. That we had a much greater focus on our business priority areas, and some of the feedback we'd had from some of the citizen assembly events was that while the subject matters and the things that people were bringing were really important and we needed to have due attention to that, we had agreed both with the public and patients, but also as a board, what our national priorities are, and we needed to make sure that we were engaging more widely in those particular areas. And that we had an opportunity to work in much closer collaboration with our other partners. Everybody's got a duty to involve, and everybody's got a duty to engage with patients and the public, and it made a lot of sense for us to do that in partnership with other ARBs and for organisations such as Healthwatch. So the new NHS Citizen approach is deliberately planned to be a much more comprehensive analysis, and that we've got both patient and public intelligence and insight and very direct feedback, as well as looking more widely. And we've identified that we think we should have several key areas that we will continue to build on as we move forward. So the first one, which is set out in the paper, and I won't go into detail because you'll have all read it, is Citizen Online, and that's really a repository for a huge variety of data, so places where people can go and look and bring it all together. Also an outreach programme where we could have dedicated expertise and support to reach out to people to understand what it is they want to say and to understand the different groups and the populations that we seek to work alongside and to provide care for. And some good examples of that are the youth forum that we've got running, and many of the board will be aware of that. We've had youth forum representatives both at NHS Expo, at our AGMs, etc. And some of the work that we've been able to do with the youth forum has had a significant impact on our ability to respond to the needs and wishes of the young children and young people. We've also got some good examples with our work with learning disability, and many of the board will know that we employ people within our engagement team with a learning disability who've got a specific responsibility for supporting our engagement with that group of individuals that we've got our massive programme of transforming care to support. Citizen representatives, which will bring together all of those individuals that actually are engaged in our forum and the different national priorities, and we'll do that through a customer relationship management system, which we're going to call People Bank, so that we've got a really good bank of people that we know want to be involved. And we have an involvement hub, which we'll develop over the coming months, which will provide support and information for those that want to be involved in providing us with advice and guidance and support, but also for our staff to support them to be able to engage in an appropriate way. And then underpinning all that will be a communication plan, which we hope will allow us to really maximise the brand and to really try and simplify how we do that. So there are quite a lot of implications about making this a really, it should be and it must be business as usual. This is not something that everybody else, that a small group of people do. This is something that needs to be almost hardwired into what we do, into how we do it. It's something that everybody thinks about when whatever decision we make. So, you know, going back to the old, no decision about me without me, think like our patients and public, ask what matters to you, to the individuals that we are supporting, and look at how we can do that differently. On September the 12th, the public and patient engagement team held an event with about 70 to 80 people, which were existing citizens that are involved in the NHS Citizen programme, but also a wider range of stakeholders. And that at that meeting, these developments were discussed and proposed, and there was some widespread support for them. One of the things that was flagged, though, and I think, and it's reflected in the paper, were two things. One was a desire for citizens to continue to be involved in the governance of the programme, and you can see that reflected in the next steps, where we've suggested that the programme board that's set up to provide oversight of citizen includes citizens as part of that group, but also that we made sure that we were able to reach a diverse range of communities, and it wasn't just a few people that felt they could contribute or found it easy to contribute that we listened to, and we really did think more widely about the broad spectrum of support that we should provide and people that we should listen to. And then the last thing I really want to say before opening it up and seeing whether any colleagues want to contribute was that one of the pieces of work that NHS Citizen will contribute to significantly in coming months will be working alongside the STPs, providing the STPs with an offer of support and actually targeting some support where we think and they think it can be best used. So actually really contributing to the STP process and the engagement with patients and the public in those areas. So I think we've got a really exciting opportunity to do even better than we have done, not losing the benefits of what went before, but building on that and turning this into something that is very meaningful for the patients and population that we work with.
Well, thank you, Jane. We know that the STPs have no chance of working unless there has been extensive public and patient engagement, so I think an offer of assistance on that front will be very warmly appreciated. Let me invite any comments, please, from the board. Michelle.
Thank you, Jane. Really helpful paper. Two points from me. One is there's been some great examples of co-production on some of the big national priorities, mental health, learning and disability, cancer, diabetes. Would you want to draw out any key points and learnings from those, really, which denote quite a change of attitude in the way in which NHS England is working? And secondly, on Malcolm's point, what potential support offer could we give to STPs or work in parallel with STPs, particularly looking at the NHS citizen outreach work that you're proposing?
So I think the lessons, certainly the lessons, and our colleagues may want to add to it, but the lessons from me about the work we've done in terms of co-production has been sometimes for individual people it's a bit daunting because you never. Some people find that it can be daunting because you don't know what we're going to be asked, and there's always a fear, I think, for a lot of people in NHS that actually we're not going to be able to deliver what people might ask for. But a really clear change in emphasis from a very simple wording, which instead of saying what's the matter, you say what matters to you, actually does help quite significantly. And for example, at Expo, we did a panel discussion with members of the audience and others around what matters to you and the impact that's made. So if you're looking at things like the Always events that we've talked about recently with learning disability, actually asking people what matters to you and what matters to you about how you're discharged from a hospital service has actually completely changed the way people responded, and it could be really simple things but make a real difference. So we found that actually proper co-production as opposed to just talking about it has actually made improvements in patient experience much easier and actually much better for people. And that's, at the end of the day, that's what we're here for. You know, we're here to improve experience, improve outcomes, and to make the best use of the money we've got. So I would say I really would encourage more people to do that and to sometimes take a bit of a step into the unknown, and sometimes it can be daunting. But when you do it, it actually makes things a lot easier. And in terms of the SDPs, I think we have produced some support and some information and some guidance, as we do. But I think there is something around some really practical support that people may want to access. And we can look at what the specific needs of the SDPs and the local population are and actually try and target that where it can have the biggest impact. And that's what we're planning to do over the coming weeks and months.
Victor, I know you're chairing a task force which is of great importance to us in carrying this programme forward. Have you some reflections on the change in direction for NHS citizens that the board should be thinking about?
I was thinking about Lao Tzu, actually, since he's been quoted already. Whenever we end up with this, we should go on the journey with all our hearts. And what I mean by that is that the NHS Citizen programme was designed with citizens, and it was the first time that had been done, really. And in its design, it was designed to challenge NHS England's culture, which is uncomfortable and difficult. And we need to be brave in engaging with citizens, because they're going to say things, and they should say things, that we will find uncomfortable. So the process of getting here has been quite challenging, and I personally have put a lot of time into this. I think what's interesting, and it's worth, if I may, Chair, I think we should thank, that it was over 4,000 people who've taken, because actually the discomfort, they put a lot of effort into the design of NHS Citizens, and I really do hope that this redesign invites them to continue in a way that continues to be challenging for us. If it doesn't, then I think we are failing. It's as simple as that. So, because I wasn't there on the 12th of September debate, I know I've received some communication from people who were about the tensions between the desires of the public, NHS citizens, to say what they feel, and our desire to stick to priorities. I understand that. That's what happens. I welcome the relationship with Health Watch England. I think that as chair of the task force that you've asked me to set up, I think that NHS citizens should deliver a big chunk of the value to achieving the 5-year forward view ambitions in Chapter 2. But I think NHS England, alongside citizens, have got a lot of learning. This is new territory, it's new work, and we're going to have to develop new skills and new insights on the way. It won't always be comfortable, but as I say, we must go with all our hearts.
I think very, very well put. Being comfortable is not a position we're accustomed to on the board.
Tell me about it.
But I think those comments were very, very wise. Jane, your response to Victor?
Victor and I have talked about this a lot. We
cool.
agree. I completely understand that, and it's and as I said, some of this is uncomfortable, but that's because it's the right thing to do.
But actually, it's uncomfortable because we fear it disrupts an established status quo, as opposed to it's uncomfortable because we disagree with the direction of travel.
Exactly. So it's the right thing. I think what Victor said is summarises very well what many of us and many of the people involved in Citizen think. So I think
Okay.
there's a way this is a way forward that actually enables us to do both, but we shouldn't forget why it was set up in the first place and what we're trying to achieve.
Right, well, thank you. On that basis, may I ask the board to endorse the new approach for NHS Citizen, bearing in mind the discussion that we've just had, and in particular the contribution we've had from Victor. Okay.